I'm Dr. Joubin Gabbay of Gabbay Plastic Surgery in Beverly Hills. Today we're going to talk about the top 5 things you need to know before you go into your breast augmentation consultation. The number 5 thing you need to know before your breast augmentation consultation is that your implant is not forever. It very likely will need to be changed over the course of your life. Breast implants are not lifelong devices, as we call them. They generally do need to be changed with time, but that's actually nice because it allows us to continue to customize the augmentation to you every single step of the way along your life. The 4th thing you need to know before your breast augmentation consultation is how your recovery will be after the operation. I actually think this is one of the most exciting advancements we've had in this generation of breast augmentation. In the old days, people had a really tough time. They were in a lot of pain. They were bruised like crazy. That's all changed. This modern generation of breast augmentation has evolved so that the techniques we use are much less invasive, much less traumatic, and the recovery is much, much better, much more comfortable. The 3rd thing you need to know about before your breast augmentation consultation is that there are a lot of steps taken during surgery to give you the best pain control after the operation. I would say most important thing in breast augmentation surgery is doing what's called a bloodless technique. No trauma to the body means minimal pain afterwards. So what I do during this operation is I go in and prevent a single drop of blood during the operation. I also never allow my instruments to touch the rib cage or to put a lot of pressure on any of the tissue. And in doing that, the operation is non-traumatic, which leads to less pain. The 2nd thing you need to know before going into your breast augmentation consultation is silicone or saline? I definitely have an opinion. I don't like saline. I think it has a lot of disadvantages. On the flip side, I love silicone. I think it works really, really well. So let's explore this. One of the reasons why I don't like saline implants is they have a tendency towards what we call rippling, where you can actually see the edges of the implant, you can see it folding in. It doesn't have as good of a structure, meaning it doesn't look or feel as natural as a silicone implants. In contrast to that, I find that silicone implants feel more like a natural breast. They're able to look like they are more natural and in line with your breast tissue, so you don't see the implant as obviously as you might with a saline implant. For those reasons, I feel that silicone is just a much better approach. It's a much better implant, and it's one that I feel has even better longevity than the saline implants. And the number 1 thing you need to know before going into your breast augmentation consultation is your implant has to match your body. You want the implant to be proportional to you. You don't want it to be too small for you because look, it might underdo it. It might not fill out your body the way it should. On the flip side, you do not want the implant to be too big for your body because it's just gonna look wrong. The implant's gonna go way out to the side into your armpit. It's gonna look fake. It doesn't look right. We take a lot of different measurements and we do a lot of things to match the implant, not only to the proportions of your body and your structure, but also to the breast tissue that you have, to the type of tissue that you have, so that the implant characteristics match and complement the characteristics of your own breast and body tissues. So let's talk about how I like to choose the best sized implant for you. I use these calipers to measure the width of the breast, and I want the breast implant to be the same width as your breast. We know that for any given width of a breast, there are 4 different heights of implants. They're all exactly the same width, but they're different heights. This is a low profile implant. It'll give you a very subtle, very small augmentation. This is a moderate profile implant. It'll give a more full, more natural look. This is a high profile implant, which will give a much more full, verging on fake look. And this is the ultra high profile implant, which will give a very full, very fake look. Now, another important detail I always consider is that for any of these implants, there's different types of gel. This is the regular Inspira implant that has a nice, soft, natural gel. This implant behind it, same implant here, the gel is a little bit more full, a little bit more firm, or what we call cohesive. And finally, there is a more cohesive gel implant that is the most firm one we use, that gives nice projection and fullness. These gels of different consistencies are used for people with different breast tissue types and needs, and we use this to customize the augmentation to your needs. That sort of is the crux of how you choose an augmentation, how you design your augmentation. You want it to be a beautiful combination of the physical structure your body has, but also the vision you have in your mind. One of the most important things I tell my patients is, unfortunately, you can't always get what you want. We have to work within the confines of what your body will give us. Here's an example. If someone has a very, very flat, very, very tight breast, but they want gigantic breasts, I'm sorry, you can't do that, because even if I put a huge implant in you, your breast tissue isn't going to stretch appropriately. It's going to cause a lot of problems. On the flip side, if someone has a very large breast or a very, very droopy breast, and they say, I just want the smallest little augmentation, I just want a tiny little implant, and I only want an implant, well, I'm sorry, that's not going to work either, because guess what? They're going to need a lift to pull up the breast tissue to bring everything back into the area of the chest. So there's a lot there, and the key is working with the structure of your body, the size of the implant, your vision, your surgeon's conversation with you and experience to know what they can deliver, what your body will do. And it's with that team effort that's going to give you the best result. Obviously, this will not replace the actual consultation. It's a very personal, very interactive process. But if you have any questions, please leave them in the comments below. I really enjoyed talking to you about this. If you like videos like this or anything else related to my world of plastic surgery, please feel free to subscribe. I can't wait to see you next time.
Go.